Hello, everyone. Good morning.
Good morning, everyone. Good morning, Anna. Good
Hi,
morning.
Clay.
Can you guys hear me well?
Loud and clear. How
All
about
right.
me?
Yes, I can hear you. I just don't know why I'm too bright and light. I guess it's Christmas. The brightness is unbearable.
Yes, you're glowing.
I am. It's bright. It's Christmas. It's need to be bright.
How are you today, Clay? It's December 17th.
I'm feeling better now. This is my fourth week for that RSV virus to be hanging around that long. But well, I don't know really if it's an RSV, but my daughter had it in school because all the kids in school are sick. So the problem
Oh,
now
no.
is the parents who are who's taking care of the kids are mostly affected by this. Before, I never get sick of COVID when I was working in the hospital in COVID.
Yeah.
But now I stay home and I get sick. I think, right? I stay home and I get sick easily. I think because my antibodies is not as much as before. Like when I was working,
Mm-hmm.
the exposure is constant and my antibodies goes up. But now because I'm home, I really don't develop that antibodies through exposure. I mean, yeah.
It's just like back home, right? Remember when we were younger, we used to play in outside. We used to eat a lot of street food and we never get sick. But those who doesn't eat street food, they're the ones who's getting sick.
Yes, right? We get sick when we are not exposed that
Yes,
much. That much, that's just the
that
level.
much.
That much level, yeah. So how are you, Anna? How's everything?
I'm doing great. 1 week post up, getting better.
Yeah, how's the surgery? How's the wound? Is it still painful?
Oh no, not anymore. Now I can
Okay.
walk and I can do household chores. It's very unusual when you're on the other side of nursing. Like you're not the
Mm.
nurse, you are the patient, and you hear all of
Yeah.
these things. Okay, someone's coming. Oh,
Oh, it was upside down.
Good
Good
morning,
morning.
everyone.
Good morning, Paul. How is
So,
Texas? How are
oh,
you?
it's quite cold in here. It's like 60 degrees. I know I'm complaining too much about the cold, but it is really cold for me.
you better come here, Paul, so you will realize the real coldness.
I know. I think
Yeah.
I'll freeze to death there. But how are
Yeah.
you guys? Happy Sunday morning.
Happy Sunday. It's 8 days before Christmas.
Ooh, my
Oh my.
God.
It's
Time flies,
by
huh?
2023.
Right,
Yeah,
right.
yeah, we're
How's
gonna be
everybody
talking
doing?
about health. This is a good timing to talk about health, the health
Mm-hmm.
insurance, because it's end of the year, and I
Mm-hmm.
think this is where our end of the year deductible will count. Have you reached your
Right, right.
deductible?
And then we start again January 1, right?
Yes,
Mm-hmm.
so that's how it is. So it's a good
Right,
time to plan our year ahead, I guess,
right.
especially with things that we can anticipate for health
Mm-hmm,
concerns,
mm-hmm.
and we can budget accordingly.
Right. I'm gonna tell the mass story later of what hack I did back in 2018 before I did mass surgery. But yes, part of the planning is your health because health is also gonna cost you money. So proper planning will prevent you from being bankrupt. Everybody says, if
Mm-hmm.
people that worked in UK, Canada, Germany, Australia, and I know they have universal health care, so they're
Yeah.
adamant about going to the US and transferring over here because of healthcare, and they've heard horror stories about people getting bankrupt with their healthcare costs. It is true; those things happen, and healthcare costs here are outrageous. But with proper planning, I think you can find a way around it. With proper, it's part of financial planning as well, right?
Exactly. Exactly.
Health is wealth. Somebody said from LinkedIn. Hello,
Exactly.
everyone. Guys, the comment section are open, so please interact with us and tell us where you're coming from. You can share
Mm-hmm.
this show to your friends as well. I'm actually about to share it to the group. Sorry. I
Yeah,
woke up a little late.
yes, me too. I've been clearing.
Okay,
Yep.
so we can start. Which are we talking about today, Anna? What are the topics we're going to be going over?
Okay, so first, let me welcome our viewers. Please keep sharing, tagging your friends. Welcome to DNP Unlocked. It's December 17, episode 12. And we're going to discuss about healthcare jargons or healthcare lingo. You know, it's not just gray lingo, but we also have healthcare insurance lingo. We are going to decode the important language of healthcare. Join us this journey as we demystify the world of medical terms and jargons. Whether you are in a healthcare professional seeking clarity or curious individual wanting to understand your health better, you are in the right place. Get ready to unravel the complexity and gain insights. So, first topic aside to me is I'm going to discuss about the available plans. In talking about healthcare insurance, so get your pens and your notebooks. So, like I said earlier, today is the best time to discuss about healthcare because it's open enrollment. So what is open enrollment for healthcare? It starts every year. It's annual, November 1 to December 18. But if you are working for yourself or you have a business or you're a traveler, you can also get insurance from the employer or private insurance. The enrollment is open until January 15. So what are the available insurance for yourself? So first thing, let me ask about you have to have a premium. Dr. NursePaul will discuss more about what is premium. But PCP, primary care provider or primary care physician. This is the main captain of your healthcare. The go person, the one who will make referral to any specialist that you're going to. And this is the person that it's either be an ME, PA, or a doctor. Every year, you're going to have your annual examination with your PCP or primary care physician. Now, we have another one, a network. So what network means? The group of doctors or hospitals or healthcare providers that have agreed to work with a specific insurance. This is here in the US, I know back home I came from the Philippines, it's different. Here in the US, healthcare, they have groups. They have, where I came from, I'm from New York, we have Crystal Run Healthcare Group. We have Horizon Healthcare Group. And this group of doctors, all of them, they have surgeon, education, OBGYN. They also work in a certain hospital that accept that insurance. So that's what network means. So now there are in-network, those physicians or providers that accept your insurance, and there are also out of network. Out of network means this kind of provider or hospital or facility doesn't accept whatever insurance you have from your employment, from employer, from your private insurance, or from the healthcare market. Just a reminder, in-network and out-of-network will play a big role in choosing a healthcare insurance plan. So number one, HMO. Can you please, moderator, can you please pull out the slide? Thank you. I'll just ask first the HMO, Health Maintenance Organization. This one, remember, PCP, primary care physician. You're gonna need a PCP because HMO insurance needs a referral. You have to go for your primary, hey, I have to see an OBGYN or I have to see a dermatologist. You cannot just walk in to any dermatology office or that you want to see. They need a referral. They're gonna look for it, they're gonna let you in. But HMO offer a lower out-of-pocket but limited provider choices. Why? Because most of the HMO, they only accept the in-network. Remember earlier, I asked about what in-network and out-of-network means. Second, PPO, Preferred Provider Organization. With the PPO, the difference with the HMO is you cannot take, you no need to have a primary care physician referral specialist. Like if you want to see a dermatology, neurologist, you can go walk into their clinic, make an appointment. So there's no limitation when it comes to seeing a physician when you're under the PPO healthcare insurance. And they offer a lot of freedom. They're flexible. I mean, going to your primary to ask for a referral will take another time and will take another appointment. And you can both use the out-of-network and the in-network, unlike the HMO. And the third one is EPO, Exclusive Provider Organization. The word itself, exclusive. Similar with EPO, it does not cover out-of-pocket, the road exclusive, but out-of-network care except in emergency. So during any emergency situation and you call this doctor, they will accept you because it's times of emergency. And no new referral to the network, and it's cheaper than the PPO. Okay, the next one, POS, Point of Service. Combine the feature of HMO and PPO. You need a primary care physician or provider. You need a referral, but offer more coverage for out-of-network. So I hope this slide will help you decide or know more about the differences between these plans. I know there's a lot to remember. All you have to remember, do I need a primary care or ECP? Does it cover out-of-network or does it only cover in-network? How about referral to specialists? Because you're going to need it. And one more reminder, before you get any available health insurance plan, make sure that your primary doctor or the hospital nearby to you accept that insurance because it will make a big difference. But if emergency happens and your insurance doesn't being accepted by the hospital, of course they will always cater for any emergency needs that will happen. So last one to also it's not on my slide. HDHP, High Deductible Health Plan. This is what we have right now as a family. What does it mean, high deductible health plan? From the word itself, the monthly premium is lower, but it will require you a higher deductible. Later on, Dr. NursePaul will discuss more what is premium and what is deductible. What I love about HDHP plan is it's eligible for HSA, Health Saving Account. And you know, Health Saving Account can help you a lot. Can help you with your credit and your savings, especially if you have a lot of health issues like me, and it will also be used for your retirement. But we're not going to discuss that, but that's how the high deductible health plan. So these are the plans that I've discovered, and I just want to remind you guys that every year you will receive an email from your HR about the enrollment. If you have your own business, if you're a traveler, you can enroll via healthcare in state, whatever state you have. I'm in New York, so we get our health insurance from the marketplace. It varies, it's not all the same. I know we live in the United States, but each state have their own rules and regulations in terms of health insurance. Make sure that you sit down, take time, and study what really will benefit for your family, especially if you have a pre-existing condition. These are the conditions that you have: hypertension, diabetes. It will also play a big part acquiring a healthcare insurance plan. And before I go, I just want to remind you about the summary of benefits and coverage. It is called FBC. This is the snapshot of your healthcare insurance. You have to study each of it. It will give you the deductibles, the amount of money, the premium, the co-insurance that you have to pay. So don't forget open enrollment. Every year you have to enroll. And if ever, mom, I was just hired May or February, does it mean I have to wait for open enrollment in November? No. Any changes with your life, you have another baby, you move, you change job, enrollment for the health care is available, and you will be informed by your HR or the hospital that you're working with. So any additional information that I missed, Paul and Kay?
All right, we are back.
Uh,
That was
yeah.
very thorough, Anna. I love it. I wish we had something like this when we were new. Because honestly, with me,
Mm-hmm.
Kay, I was so scared. I have GERD, I have reflux, and all that. I bought my medicine, and then on the first 2 months, I already was having nausea, and I always get nausea. In the Philippines, I can just buy medicine from
Yes.
from the pharmacy without
Mercury.
scripts,
Yeah.
right? Because they're not that strict in the Philippines. Plus, it's nausea medicine. It's not like it's a controlled substance. But I was so scared to go to the clinic. I started calling clinics, and they're like, "Oh, you have high deductibles, so you're paying $200." I wish we had education like this before.
Oh yeah.
That would have helped me decide. But of course, guys, disclaimer, please do not worry about costs. If it's an
Mm-hmm.
emergency, go to the emergency room. I know people are like, let me compute. Oh, I'm gonna spend 1,000,000 pesos. But guys, I think your family would spend more if they lose you, right? Something
Yeah.
like that. To put
Mm-hmm.
it a little bluntly, but there's no amount of money that can replace your life. So just be careful. But Anna provided a very good explanation of all the available
I have my
different types of
notebook.
insurance. Right, right,
Yes, no, that's not fair.
right, right.
No, she's
With
good,
my
very
color
good.
Right.
pen.
And if you guys have option to do PPO, by the way, I work in primary care
Mm-hmm.
clinic. I do mixed primary care, urgent care, and I always have I get trouble with putting in orders, and insurance will not cover it because it's in network or out of network, whatever issues. But guys, PPOs usually, if you are in a big corporation and you get this type of insurance, it's the best type of insurance. Why am I saying that? You do not need a primary care provider to
Mm-hmm.
authorize or to write you a referral to see specialists. And why am I saying that? Because seeing a primary care provider before you can go to specialist takes time. We've had patients
Yeah.
that I need to see first, I need to clear first, I need to do the tests first before I can refer to, say, general surgery or ortho. They usually have
Dermatology,
to
yeah.
refer ortho or
Mm-hmm.
ENT, right? Because they need tonsillectomy or sinuplasty, something like that, something that we commonly see in primary care. And imagine the frustration of patients waiting for 3 months just to get that
Yeah.
pre-authorization from insurance. So if you have PPO, you do not need me or any of your primary care providers. You can go straight to specialist while waiting for your primary care provider to do all the lab tests or whatnot.
Mm-hmm.
Unfortunately, HMO can be limiting because
Yeah.
you are only limited to the in-network physicians. Anyone out of network is not covered or
Mm-hmm.
entirely not covered. Please check your summary of benefits or the fine print.
Yes, good
But we
thing that you
always
mentioned
put
that, Paul.
the
Yeah,
Yes.
I want to add there, if you are going to see an OBGYN, a GYN provider, majority of this health insurance consider OBGYN as PCP. You
Yes.
can assign GYN doctors as your PCP. You don't need referrals. So
Mm-hmm.
that's
Mm-hmm.
one thing that I've learned when I was pregnant, that they said, no, you don't need to. I was
Mm-hmm.
under HMO program. I want to emphasize this. If you are in a good healthcare system, academia hospital, when I'm talking about training hospital, famous
Research
hospitals,
facilities.
So HMO can be very good too. So I was actually in a government hospital, but the doctors that rotate in our hospital, that covers that hospital, is actually part of the top one hospital in New York. So I was, very lucky that I have access to these great physicians as well. So for me, a PPO might sound very might be good because it will cover anyone.
Mhm.
But during that time, my employment actually was an affiliate hospital by the top one hospital in New York. So I have access to those doctors too. So during that time, I did not need the PPO. And I stayed with HMO, which was the cheaper version. And if you're
Mm-hmm.
going to ask me how much did I pay for my monthly premium, the answer is zero. So I want you guys to consider both, look into the pros and cons. Number two, look at who your employer is. If your
Mhm.
employer is a very big health system that has very good physicians in their network, then you might not need as well a PPO that will cover somewhere else. Um, I usually recommend HMO for people who are new here in the United States who have no generally healthy people and they're just going to use their health insurance for preventive.
Mm-hmm.
Mhm.
HMO is also a good alternative health insurance because you don't know any doctor yet, so you're trying to feel for yourself who are the good physicians here.
Right,
But
right.
yes, I do recommend PPO highly for people who have high health maintenance. You guys visit the doctor more often, or if you
Mm,
have specific doctor that you want to go.
right, right.
So PPO
Eh,
is very good for, I guess, for travel nurses as well.
right. Another thing is um, for PCP, you can assign a primary care provider from family practice. That's
Yeah.
the most
Mhm.
common. But what people don't know is that internal medicine can also be primary care. So if you're cardiology and if you're HMO, assuming that you're on HMO because that's the cheapest, and PPO again is more permissive with who they assign as PCP. Your cardiology can also function as primary care. They can elect themselves as primary care, but they have to tell your insurance first. But internal medicine providers like cardiology can also function as primary care providers. OB-GYN within the scope of women's health. Sometimes they would refer back to us for non-women's health related, and pediatric physicians are also primary care. So those are the four
Mhm.
people. When you're an HMO, you do not need referrals. These are primary care providers. They can provide primary care. Any specialists that you would need, say for example, vascular surgeon, or gastroenterology for endoscopy, or ortho. We see a lot of orthos in our clinic, right? Or say ENT because I'm urgent care, so I see a lot of kids with sore throats and tonsils that are huge. I need to refer them to ENT or psych. These are specialists that would need insurance approval. So just be mindful of that. And again, you know what? HMO is not inherently bad. There's no bad thing, right? It really depends on what you need. If you live in a
Mhm.
big city, the HMO can also be a good thing because, for example, if you're on an HMO of a big insurance company in a big city, well, you'll have plenty of options. But if you're in a remote town where there's only two people, it's just you and the doctor. I'm just kidding, but US is big. It can be in a very remote town. Say, for example, you're
Yeah,
working
you
in
and
rural
you and your
Alaska.
AFAM, right? You and your AFAM.
So
you
there's
know,
no
it's
there's no provider in the
what is
town,
this? A
huh?
Grey's Anatomy story? You and your doctor
But
only.
right. But the point is, if you're in a remote town, it might be very hard to find a provider, especially with the specialists that you would need. Again, primary care providers are everywhere. Specialists are hard to come by. So, like what Kay has been saying, and Anna, check what you need, right? Assess what
Mhm.
you need, and then go from there when you make your decision of what to get as far as insurance is concerned. There's a misconception, Kay, that always pick the cheapest, right? Oh, this
Yeah,
is
Mhm.
$300 and I'm a travel nurse. I'm gonna pick this, right? But they end up
yeah,
getting hospitalized and they're high deductible and they're $8,000 deductible and their out of pocket maximum is $10,000. Now they have to shell out $8,000. Versus if they get the $550, $250 more per month, times 12 months. Kay loves computation. So that's 2,400 a year.
Let me
But
finish
your
my
deduct
coffee.
that's like
I'm
2,400 to
addicted.
$3,000 a year. But that's still lower than the 8,000 that you have to pay upfront because of the deductible. So I like to do my math. Excel is my friend. I can compute at the top of my head, but I'm more visual. So I do a side to side comparison. I know Kate does the same, but Excel is my friend really because I just put computations and plug in my numbers, and the Excel does a trick for me.
Yeah, yep. No. So it's a good thing that you mentioned, specifically how you're gonna use this health insurance. I'm gonna
Mhm.
give you a timeline of what my health insurance looks like. When I started here in America as a single person in a big city with a lot of hospitals, a lot of doctors, I wasn't a picky patient. I can go whoever because I didn't know anybody.
Mhm.
So my health insurance plan there was HMO, no, under my government hospital employee. And after that, I started become a traveling nurse. Um, I started looking into the PPO section. Okay. PPO. No, no, no. There's like, bronze, silver, there's gold. Bronze are the cheapest, and gold, platinum are the highest and most expensive health insurance. They have the most coverage. You're talking about, okay, do you want a smart car, little smart car, or like your Honda Fit, or you want your Lamborghini? Okay, so you have to choose from that. So during that time, I was traveling nurse. I am under contract. So which means I am very careful and particular with my health because if I don't work, that contract will never finish. Or
Mhm.
if something happens to me, then I might have to, pay that contract, but I don't want to do that. So when I'm under contract, I want to make sure I'm in the best health as possible.
Right.
So meaning if I'm outside my state or my city, if I don't feel well, I can go to wherever I want. So PPO helped me. So during that travel nurse years, I stayed under PPO. And then I was in Boston working in a very good hospital as well. Then I look into actually those doctors who are covered under my company as well. And I said, okay, maybe this is time to go switch back to HMO because the doctors in their network were very good. But when I was in the middle of nowhere in Connecticut, I made sure I had PPO. Again, when I go to the city, very good doctors, very good physicians in network. I chose back to HMO. And then now with the family, I know we're gonna have, children later on in the next year. We're planning to have kids next year. So then I change again to PPO and
Hmm.
to the gold level. We changed to the
Right.
gold level from bronze to silver to gold, primarily because we are expecting to spend more money because
Hmm.
we're expecting to have a child. So we made sure when open enrollment came, like Anna was saying today, it's open enrollment, started from end of October to around December. So you can change your health insurance plan. So you
Right.
call your provider and you can make those changes. But when you have child also, or if you have there's a thing called qualifying events. Anything that happens to you differently, you change address, you change jobs, you just change, anything that
Hmm.
change into your employment status
Hmm.
or your family situation,
Hmm.
um, you can change. You don't have to wait for open enrollment. If your spouse started
Right.
to have a job on April, you can
Yeah.
also change that.
Life changing events. Right.
Yes,
New
qualifying
kid,
events.
qualifying events. New kid, marriage, divorce, and you lost insurance. Those are qualifying events. And another thing, guys, you have to remember this as someone coming from the ER world. If your insurance is Affordable Care Act compliant. Affordable Care Act compliant meaning you probably bought it from healthcare.gov or healthcare marketplace or your providers. I'm sorry, your work or employers. Um, Emergencies, regardless of where you are, as long as you are in the continental U.S., all right, as long as you are within the U.S. territories, all right, are covered. All right. There is a strict rule for ACA compliant insurances that Emergencies are not going to be subjected to PPO, HMO, EPO rule. So EPO is another version of PPO. It's like a lean version of PPO. It's like exclusive provider network. So PPO, but exclusive. PPO is more like national. If you are in Texas, you can get care in Alaska if you are in Alaska. But emergencies are different. If I'm, for example, I have an HMO, and then I traveled to Arizona, for example, and got into an accident, I can go to the emergency room, get emergency care, emergency doctor rules out and any emergencies and dispose to like send me home or admit me. It's during the admission that you're gonna have a problem. Because if you're in an HMO and the admitting hospital or performing proceduralist or doctor is not covered by your HMO, then that's where you're going to get billed. Remember, HMO can charge you 100% co-insurance if out of network, right? PPOs is that's where PPOs come in handy. The other option is to ask them to fly you or ambulance you to the admitting hospital. You have that right to choose as long as it's not emergency and you're not going to die on transport and you're stable, then they can transport you. You're just gonna have to pay for the transport, of course. So check those things, like Kay was saying. Check, like what I did before coming to the US back in 2017. I already know I'm gonna get tonsillectomy eventually down the line. I always get sore throat. I still get sore throats right now. It's much better after tonsillectomy, but I got my tonsillectomy back in 2018, less than 1 year in the US. I already know that my ENT in the Philippines advised me to do it, but I said I'm moving to the US in the next 2 years. I'll just do it there. Insurance will cover it, and I really don't want to have complications or problems of bleeding, something like that. If I'm going to the US, you know what I mean? Like, I want everything to be smooth. I waited for it for like almost 10 years. That's what I was thinking. So I was like, you know what, I'll do it in the US. When I got to the US, insurance was expensive, of course, because we're still competing in Philippine peso, right? So I got the cheapest insurance because I started my work March 20. I have 9 more months. So it's like, I'm going to power through 9 more months. I'm gonna start the visits, get established with physicians, and then I'll do the thing next year. And November that year was open enrollment, okay, and I switched from the cheapest to the most expensive, from $30 per paycheck to $60 per paycheck. My deductible went down from 3,000 to 500 that year. So I honestly paid just I did my surgery March, probably $650. The total bill was 28,000. $650. My deductible is 500. The other 150 was for labs and all co-pays for medicines. To cut it short, that's what all I paid. But if I didn't switch to the cheapest insurance and I was trying to save $30 per paycheck, it would have costed me $3,000 because the deductible is 3,000. Something like that. Assess your situation. Kay planned when she was about to when she was planning pregnancy, because pregnancy, you need to plan your lives, guys, because
Exactly.
honestly,
Especially in the US, you cannot
yeah,
just say,
yeah,
"Oh, I missed my period."
yeah,
You
because
know, oops,
like I
oops.
said, right, if they
It's like,
can
oops.
bill you for the air that you breathe, they would, right? I'm not gonna be surprised if 100 years down the line, where we're not here anymore, they start charging for air, because they probably would. But everything has to be planned, because everything has as an associated cost, whether it's
Yeah.
your medical insurance or you got sick and you have to do this. If you're sick, you need time off too. That's why the other last month we were talking about indemnities and short-term
Yeah.
disabilities and all
Mm-hmm.
that, because it can really bankrupt you. But do not try to save $30 if the value of that $30 you're trying to save is going to give you $10,000 value, something like that, right? Insurance is one of those things that you really don't want to use. But hey, I always tell nurses when they choose insurance, it only takes you, and listen to me, because I worked in the ER, and now I work in primary care. I still see my patients' bills, right? That I would tell them, I could have seen you in the primary care for this. It's just a strep throat. Why did you go to the ER? Right? Anyway,
Exactly.
it only takes 1 year visit. It only takes 1 year visit in a year, and you could max out your deductible. To be honest, like abdominal pain is honestly easily 10 to 20,000 if the CAT scan is already ordered. That's whew, hospitals can charge you $5,000 for that CAT scan that you could have done $300 if you have just waited for your primary care provider to triage you at the very least, something like that. So think about it. If I land in the ER
Sorry.
today,
I know I
how
should
much
mute.
am I willing to pay? Am I willing to pay that high deductible $5,000? Or do I have kids that are 3 years old, 5 years old, and they get hit with RSV, flu, strep, COVID, you name it, they got it. And they get to see the pediatrician every time, and they have asthma, and they all go to the ER. Please don't do the cheapest insurance because the kids are going to be an extra
Right.
expenses out of your pocket. Yep.
Especially every time the weather will change, summer and the
Yes.
winter and then
Trust me.
spring.
I'm getting sick myself. I was actually coughing
Mm.
earlier. Thank you for Theraflu. I hope Theraflu will sponsor me because I'm thankfully Theraflu is not a controlled substance, y'all, because
Or
it's not
else.
addicting. Because oh my god, I have boxes of boxes. I don't know. I just the cold weather is my trigger. So I have seasonal allergies, and of course, when you're congested, you get bacterial and viral infection all the time. So that's my life. But anyway, but that's
May,
it.
Sir
Just
Paul,
plan ahead. Hmm.
may I ask about income from my personal experience? So like
Hmm.
4 years ago, I was admitted for 7 days in the hospital, and I have
Yeah.
a referral to a neuropsychiatry. So when I was discharged, I was following up with him, and the office said, "Oh, we can't see you anymore." I was like, "Why?" When I was admitted,
Oh my
that what
goodness. I think I
he's
know the
my
story.
yeah, he's my doctor. I'm a person with habit. I don't want to change people. I just want to go to the same doctor, same
Hmm.
practice. So there will be coordinating with my care. And it turns out my insurance doesn't really cover him
Yes.
when you got discharged. So something to look into your plan. So that's why
Right.
I have to remind you guys to read those fine print. When you're
Right.
admitted, they're gonna free you. But when you're discharged, you're gonna look for another provider, which will take
Right.
another time, another effort. And just a reminder, when I was in the Philippines, as long as you have the money, you can walk in for doctor's clinic, right?
Right.
Here in
Right.
the US, FYI, even if you have the money, you have to make a schedule. You have to make an appointment. When you
Right.
cancel it, you have to pay for it. So you have to show it. So show for
Right.
that appointment. Like I have a message last night that I received. Mom, I thought American Dream is real for health insurance. And I was like, you
Hmm.
better watch our show tomorrow. You're gonna learn a lot because it's not that easy. Health insurance, especially if you're a newly immigrant, you have to set aside to learn from it, especially when you have kids, when you're planning to be pregnant, and you have a lot of pre-existing conditions too. We have a newly immigrant nurse who arrived a few months ago, and his husband have a lot of pre-existing conditions, diabetes
Yes.
and hypertension, and she took the quickest one, call and pay. So, Mom, I've only been here for 4 months, but my medical bills are like I can't even pay it on day-to-day basis. So please don't
Right.
forget to share. And if you miss the show, you can always go back, check the DrNursePaul and Traveling Hack, and it's also in YouTube.
Right. Right. And okay, so I'm gonna discuss the different terminologies. It will
Mm-hmm.
be a basic terminology discussion, and then after that, I'll give a short example. This will be very quick because we've been talking about these copay and co-deductibles, and of course, I did
Premium.
my due diligence when I was new. And I'm an informed consumer. I always want to be on top of how much does it cost. I'll do the computation myself. I don't trust them when I tell them, um, how much do you think I'll pay? They're like, I think
Mm-hmm.
you're just gonna pay $30. But no,
Yeah.
I read and I clarify with them. You know what? My insurance says I have a copay. So, guys, you are your own advocate. Okay, be on top of that financial aspect of your life. And when I say financial aspect, it's everything from the moment you wake up, right, until you sleep. It's finances all day long, and that can really put stress on you. But anyway, let me flash my presentation. So I did this last night, And we're going to talk about what is premium, what is deductible, what is copay. When you say premium, it's the amount of your insurance cost every month, or in the setting of nurses, we pay it bi-weekly, especially if we're W-2. So when I was self-employed, I work now for the county, so I get my insurance free. But when I was self-employed for a year, self-employed by my business, that I pay it monthly because I got it from the marketplace. When I was full-time nurse, I was paying it every 2 weeks. When I started travel nursing, I switched out from the Cobra, from the insurance of my employer to my own insurance in the marketplace. So that's every month. So find out how much you pay, find out how often you pay. And this is one of those things that you want to be. Please listen to this. All right. This is one of the things that you want to be on auto pay. All right. Please. It's 2023. There's a lot of automations nowadays. Auto pay. All right. So which means you do not want to miss this, because you do not want to show up in the ER one day and you show up your insurance card, and trust me, it happened too often. All right. And they say, oh, your insurance lapsed because it said that you did not pay it for a month or two. All right. So auto pay. All right. Make sure it's an auto pay. That's your premium. That's how much you pay every month, bi-weekly. How much it is depends on your insurance. All right. If you're a W-2, if you're currently full-time nurse, you pay it every 2 weeks, right? Deductible is the money you need to pay before the insurance pays. Before the insurance kicks in, deductible is what you need to pay up front, all right? So this is where many people don't understand deductible, right? This is where many people are properly what's this not aware, not informed, and this is where they got confused. Your insurance does not kick in, they don't start paying until your deductible is met, and that is in a given year. Earlier I heard Kay saying, you know what, it's going to be January soon, the deductible resets to zero, right? So get all the healthcare that you need now, because you already spent your deductible for this year. If you already maxed out your deductible, now is the best time to see the doctors. Because you want that done and billed for this year. Because by January, we go back to zero, right? So if your deductible is 500, you only pay 500 for the whole year, just like what I did in my example earlier, my own personal experience, and then the insurance kicks in and pays everything after that. If you're in high deductible plan, I've seen outrageous plans to where the deductible is $10,000. Guys, I think those types of insurance are worthless in the sense that you have to pay $10,000 first, right? Before the insurance kicks in. So make sure that that type of insurance really works for you, because it only takes one ER visit and you could easily be charged $10,000. All right. So be very careful with the deductible. All right. So higher deductible plans, or HDHP, Anna talked about it earlier, are much cheaper, but they are cheaper for a reason. You already know how it is. The cheaper it is, the higher you need to pay when you get sick. You're probably paying cheap right now. That's your monthly insurance. If you're otherwise healthy, this may work for you. If you have coexisting, pre existing conditions, if you think you're going to have surgery, if you're that person who always lands in the ER for something very acute, um, I don't think this is good for you, because high deductible plans can easily drain your emergency money. Copay is a set fee for visiting doctors on top of deductible. So, for example, you have the $2,000 deductible, but it also says whenever you see a primary care provider, you also need to pay $30 or $50 or $100. Whenever you do your labs, you need to pay $50. Whenever you do or whenever you get your medicine, you need to pay $5 or $10 or $15. Whenever you do your surgery, you have $1,000 copay. That's copay, right? That's a set fee for visiting doctors, and usually copay is part of deductible. It takes it out of your deductible. Co-insurance, on the other hand, is the part that you pay after deductible. So even if you met your deductible, the co-insurance would still be paid. All right. So for example, after meeting deductible, you have 20% co-insurance. So if you see an ENT and they bill you $1,000 and you already met your deductible, but you still have co-insurance of 20%, then you still have to pay $200. It gets confusing, right? Co-pay is part of deductible. Co-insurance is not part of deductible. Now, here's the safety net, is what I call it. OOPM, or out of pocket maximum. I consider it as a safety net, which means it's the max, right? After a certain point in a year, and depends on your insurance, you will reach your out of pocket maximum. That includes your deductibles and co-pays, co-insurances, because co-insurances, you still need to pay that on top of deductible, plus your pharmacy and laboratory expenses, right? When you add all of these together, it adds up to your out of pocket maximum. After you reach out of pocket maximum, whatever it is, the insurance will pay. So usually out of pocket maximum is somewhere around $8,000 to $10,000 a year, which means your deductible could be $5,000, but your out of pocket is $8,000, right? If you meet $8,000 in a year, including your co-insurances, right? Your insurance will cover everything after that. So what I consider out of pocket maximum is the safety net, all right? I always tell this to the nurses, all right? Make sure that when you buy insurance, you look at the OOPM. This is your threshold. This is what liquid money that you should have, meaning this is your emergency fund, right? Every year, you should have the money that's equivalent to out of pocket maximum, whether you use it or not. If not, then good, you can invest it. If you use it, then at least you have that money, all right? So to not bankrupt you, because your out of pocket maximum is the threshold, not the deductible. It's the out of pocket maximum. So for example, right now, my out of pocket maximum is $5,000. I have $5,000 for my emergency fund for hospital bills. That's every year, all right? Um, in case I get hospitalized, knock on wood, and I go in surgery and I pay all my copays and co-insurances, and I have $5,000 bill, I can still pay $5,000. Anything after that, my insurance pays. And then the network type, I already talked to you about. In network, which means your insurance covers. Out of network, insurance does not cover. HSA, FSA, I think it's the last one is FSA. HSA, that's your own money. You invest it, it does not expire. FSA, it's your employer savings account. That one expires. You have to use it within the year, because after that year, it becomes zero. So whatever money you have there, they're going to take. And we've talked about HSA and FSA in the past. Let's put a scenario here. So say, for example, let's look at the next presentation. Example, you went to the ER for abdominal pain, and your total what's this? Your total bill is $10,000, right? From the CAT scans, labs, medications, IV fluids, and whatnot, consult to surgery and all that, right? For example, your insurance coverage is $2,000 per year for deductible. Your copay is $500 per ER visit. Your co-insurance is 20%, right? Out of pocket maximum is $5,000 per year, right? So that's your coverage. So how much will you pay? Deductible is $2,000, so automatically you're gonna pay that. $500 is paid for the ER visit. Your co-insurance is 20% of 7,500, so that's 1,500, right? And the total amount you're gonna pay is 2,000 plus 500 plus 1,500, more or less. All right. So more or less, it's going to be $4,000 for this hospital visit. Remember that your out of pocket maximum is 5,000. So you haven't reached that threshold. You're going to pay the whole 4,000. I'm confused. You tell me, right? Because the deductible is only 2,000. Yes, but you still have co-insurance that you need to worry about. That's why I'm saying your threshold should not be the deductible, but the out-of-pocket maximum. All right. So that's what you need to look at when you're buying your insurance, purchasing your insurance, or choosing what insurance to pick when you are with a new employer. Every time you switch out to a new employer, you switch your insurance too, and make sure you're fully covered, because sometimes those breaks in insurance, you can have a gap where you don't have insurance and you cannot see your doctor. Or when you switch your insurance, you might have different in-network providers and your doctor might not be in it. All right. So be very careful if you want continuity of care with your, particularly your primary care provider, because you established your relationship with them. Always ask your primary care providers what insurance do you cover? Are you covering this insurance? Are you covering this insurance? Because I'm about to switch to another insurance and I still want to see you. I don't want to switch out to another provider. All right. So that's it, guys. That's my presentation. I hope that clears out all those different types of pays, copay, insurance, and OOP, and of course your deductible. Okay, so make sure that your upper threshold for your money for your health would be your out of pocket maximum. All right, and this can get confusing because this is only my competition is only for single. Out of pocket maximum is different for single and family. Usually with family it doubles up for 5,000 for single person only, but with your family it can become $10,000, right? And the deductible could be a single person only. It's a different deductible when there's family, so be mindful of that as well. Do your own computation, be your own advocate. All right, back to you, Anna and Kay.
A lot of people are confused. Like, I thought I'm not gonna pay anything since I have an
Right.
insurance. Why I went to
And
urgent care?
Anna, sorry, I think you got caught because you were in the backstage. You were saying something before we
I was
cut.
saying it was very informative, especially with the
Yeah.
deductible, because a lot of nurses are sending me messages, ma'am, I thought I have insurance. I went for urgent care and they were asking me to pay $40. And when my
Right.
daughter saw a specialist, I was like, having that card of insurance doesn't give you, uh, free consultation. So I asked her, do you know about deductibles? No. Are you aware of premium? No. Are you aware of co-payment for insurance? So I think those out of pocket from us that we're paying are very important, especially for the newly immigrant nurses. I mean, I know healthcare insurance in the US is very expensive and every year it goes up. So
Right.
you have to be aware of the trends and the needs of your family. And like Dr. Nurse Paul said, it's really different when you're single. Like me, we're a family of three. Each of us have a 5,000 deductible, and as a family, we have more than 15,000 deductible. So every time I have a doctor's appointment or before I'm about to have an appointment, I always check my plan and I always make sure that the doctor that I'm gonna see is in network, so I'm not gonna pay more. And when I was new paying all, I made this mistake. My primary was not under the same in network, and my other
Mhm.
specialist I met. So imagine the hassle of when I go to my specialist, hey, what your primary said? I thought he sent you an email. I'm still working as a nurse, but I'm already a patient. Like, I have to communicate. So what I did, I switched my primary care. I made sure that we're in the same healthcare group and same in network to save you
Right.
time, effort, and all of the hassles. How about you, Clay?
I I'm not a very picky person when it comes to who's in network or who's with not network. What I go is to the reviews. Whoever has good reviews
Mm-hmm.
on this website, like Doc Zoc. I'm not promoting
Yeah,
any apps
yeah.
here.
Mm-hmm.
There's a lot of website here that are actually have have reviews for doctors. I think Vitals is also the other one, right, Paul?
Mm-hmm.
Vitals,
Mhm.
Doc Zoc, Health
Sesame.
Grades, Health
Yeah.
Grades. Yeah. So I go there, and I'm not really particular who I'm gonna go, but the reviews, I want to make sure that person has good reviews. And then if there are like five doctors with good reviews, I want, and then that's the time I filter out who's the
Mm-hmm.
good one that I'm gonna go. Because we move around. I told you we move 14
Oh, yeah,
times
yeah, you're
in
right.
17 years. 14 times
Right. Right.
moving
Right.
in 17 years. So technically it's like we're moving every a little bit over a year. So
Right.
so for us, I realized that I'm not going to be stuck with one doctor. And then they asked
Mhm.
me, "Who's your PCP?" I said, "My husband." "Who's your husband?" Right? So but we're not. But those important things that everybody has to remember is be particular, like Paul said, read properly. So I'm gonna quickly share my screen. We're short of time. We want to give more time for
Mm-hmm.
question and answer. And the way I would explain this health insurance is because it's very complicated, it's overwhelming. So I'm gonna where is this? Share screen, right? Share slides. Oh, share screen. Give me a second while I'm having technical issues. I think I
Yes.
froze.
And guys, the comment section. No, no, we can see you. Comment section is open, guys. So please, if you have questions, we're gonna answer that. And our topic for today is about insurance. So you have questions, we probably could answer that. We are not professionals, we are not insurance professionals, but we can answer it to the best that we can.
Okay, so do you guys see my screen?
Si, señorita.
Okay,
Yeah.
so the way I would explain to people what is health insurance? What am I gonna pick when I arrive here in the United States? Which one should I pick? So the question there is, do you want to pay more now or do you want to pay less later? I mean, pay more now and then pay less later, um, or you want to pay less now, but you're gonna have to pay later. So I'm gonna go back to the first screen. So the first screen here, we're talking about possible PPO plans, possible silver or gold coverages or platinum coverages. Because the monthly premium there, if you see, I put $2, $2 sign. But if you're gonna get sick, if you're gonna visit doctor, you're gonna pay less later. So when I mean later, that's where Paul mentioned like the deductibles, the copay, the co-insurance, the out of pocket. And generally, these people is for with health issues or with people who's anticipating procedures or high cost of health insurance later on. This is also, I consider this for people, less risky. When I say risky, we're not talking about high risk patient. We're talking about the risk tolerance of your financial status. For people, when I say less risky people, these are the people who I would say, oh, I don't want to think of a high bill later when I get sick. Okay, these are called conservative people. They try to pay right now, but later on, I don't want the headache to see a huge amount of bill. So again, when you see a PPO, when you see a plan that is like gold or silver or platinum, these are the more expensive health insurance coverage, but they do cover very well. But the only thing is you're gonna pay monthly premium that is higher. So pay attention. I put a color yellow because if you look at the stoplight, there's red, yellow, and then green. So green is like good, right? But red is stop, is like bad. So I color code most of my education materials for people to remember. So yellow means you're in the middle. You're not paying a lot, but you're paying in the middle. So if you're gonna add this dollar signs, if I put value to it, so $2 sign here on the left plus $1 sign on the right, which means that's total of $3 signs, okay? That I'm gonna be paying if I get sick later. Now we're gonna go to the next slide. These are the high deductible plan. These are your bronze plans. These are your less coverage plans. They are cheapest. True, you're gonna pay less right now. Your monthly premium is the cheapest. But later on, if again, we're gonna cross that line that says if, you will need to use your health insurance. You get sick, you get into an accident, you get into unnecessary or unscheduled hospitalization. Um, you're gonna pay more. Okay, not I'm saying unnecessary health hospitalization, but I'm saying is unscheduled, unplanned, something happened. You're gonna pay more later. So if you pay attention to the dollar sign, I put $1 sign here to the pay less on your monthly premium. But if you get sick or if you have to use your health insurance, and you will have to pay your deductibles, copay, or insurance out of pocket, you see that I put $4 sign. So if you add that $1 sign to the $4 sign, total amount of payment that you're gonna do is five. So by looking into that, I'm going back to the previous screen. The pay now, the pay more now and then pay less later will give you about $3 value. Okay, but then the pay less now and pay more later will make you pay a $5 value. What does it mean? These are for high deductible plan is only if. Okay, so that's why I say this is for people with in general good health or for people with high risk tolerance. When I say high risk tolerances, are again financial risk tolerance, which means I'm willing to take a risk right now, paying low in premium because I know I'm going to be healthy. I'm healthy. I have no health insurance costs, and I'm only going to use this money if I get sick, if I have to pay a huge amount of bill in the hospital. Okay, higher risk tolerance. Majority of the time, I'm on this high deductible health insurance plan for me because I'm a nurse. I don't go to the ER when I'm coughing. I don't go to the ER when I'm sneezing or colds. Most healthcare professionals are, they self-manage at home. They don't go to the hospital unless they're dying. So for me, I'm a high deductible health insurance plan. However, if I have a family member who needs a lot of health insurance usage. Let's say I have a child who needs speech pathology. I have a child who needs rehab. I have a child or a spouse who has maintenance medication. I might have to consider going to this side, okay? Because I'm going to use it more often. Later, I will pay less, okay? So those are the two big identification on how you should choose your health insurance. You have to identify how much money you have right now that you can pay. For example, I'm going to give an example. I'm going to visit Dr. Nurse Paul, right? Nice picture, Dr. Nurse Paul, right? And Dr. Nurse Paul said, I'm going to bill you 250. But Nurse Paul said, I will send this to your insurance first, and then you will have to settle with us. So the health insurance said, we have negotiated rate with Nurse Paul, with Dr. Nurse Paul, and the amount of money that he should be charging, or we're going to negotiate a rate, is 150. So then the health insurance will send you that explanation of benefits in your mail. But during the visit you will pay Dr. Nurse for $30. Expect the bill to arrive 120. Okay, so that's what it means when health insurance plays in to bill you, in behalf of Dr. Nurse Paul. So this is an example of let's say this is an example of a high deductible. Okay, so which means I'm expecting a bill that is higher than usual. However, if I choose a low deductible plan, or like those silver or gold, the platinum plans, this is going to be the scenario. Dr. Nurse Paul sends me a 250 bill for visiting. The health insurance negotiated plan is 150. My copay during the visit is $20. And my insurance says that we're 50-50, which means every visit, the insurance will cover 50 and I will cover 50. So the 50 of 150 is 75. Since I paid 20 during the visit already, the bill on my mail will be arriving around $55 because half of the 150 is 75. If I add that 20 and 55 will be 75. Okay? So that what it mean. That's the difference between a high deductible and the low deductible. I'm going back to the previous slide. This is an example of a high deductible plan, and the next slide, this slide, is an example of low deductible plan, or your very good coverage, your gold coverages. Okay, so I'm gonna stop the screen there. All right, where's everyone? I thought I
We
lost you
are
guys.
here.
Here.
That was a very good presentation, and you have to use me without permission. I'm just
Oh
kidding.
Yeah, it's
no.
public, a publicly accessible picture.
Right.
So, but thank you so much, for this opportunity to share those information. I
Mhm.
hope it gave you a little bit understanding on how to choose those health insurance plan. It doesn't mean that the most expensive is the best. Like Paul
Yeah.
said, it doesn't mean that the cheapest is the best either.
Mhm.
Right? So what you will have to do is what is the more valuable for you.
Right.
Because for
Right.
me, it's not the same with Anna. It's not
Mm-hmm.
the same with Paul. And also
Right.
sometimes where you live,
Right.
the states have jurisdiction on what is covered or what is not covered, something like that.
Right.
Right,
Right.
Paul? Is that
Right.
right?
Right. That is correct. And Kay, we always get this question where, especially in the group that we manage, right, in Lefora, and even in my direct messages, and I'm pretty sure you guys too, we always get this question where they show us their coverages and they're like, what do you think is the best, right? And my
Yes.
response is, depends on your personal needs, right?
Mm-hmm.
Some people do not like that because you pass back the responsibility for them to think. It's like telling
Mm-hmm.
me, think for me. But
Yes.
honestly, if
Exactly.
I have
Yeah,
to do
I'll
that,
think for you. Pay me,
yeah.
right?
I
I'll
was
think for
gonna
you.
say,
Call
thank
me.
you,
I'm
Kay. I
gonna.
was gonna say, I think I should start charging for that because this talk alone took us almost 1.5 hours to just explain the basics of
Mm-hmm.
how to choose the correct insurance. That's not even including personal situation scenarios. And if just 5 people ask me that question in a day in my social media, right? That will take my time away from my family, from my work, from my students.
Exactly.
You get the point. So the point is, guys, at the end of the day, be an informed consumer. We can direct you to sources, but we are not professionals. We don't bill for for these services. Don't get offended when we say depends on your personal situation, because that is actually what it is. It depends
Yes.
on your personal situation. Kay and Anna's situation does not apply to me. I'm not a female. I don't have kids. I'm not gonna have kids at the moment, right? So I'm not gonna see an obigyn, definitely for myself, right? So that's out of my equation when I do my computation for what's this, for my medical care, something like that. So it does not apply to all. Like for example, my computation may be different for majority of you guys because you guys have kids and spouses, and having kids and spouses jack up your insurance
Yeah.
cost
Yeah, being
by
Mm-hmm.
a
married is so
great lot.
stressful, right?
But a great like yeah, example, like for me, my insurance is free because I'm a county employee. But if I have a spouse, that adds up another $400 in my insurance because they're not
Yeah.
covering the spouse, right? So
Mm-hmm.
something like that. I can imagine if you have 3 kids, 4 kids, 5 kids. I would see these patients where they have all their kids, all of them have RSV, and all of them have co-pays. So it can add up pretty quickly for people with family. So please assess your personal situation. I like Excel to start with. I always start with how much did I spend this year for healthcare costs? Because if I'm gonna do the same plus times 1.5, that could be my accounting for inflation and probably more visits. That's probably what I need for next year or more. So you always change that, and don't be scared to change insurance all the time because it always depends on your needs. You also don't want to be overpaying for something that you don't use,
Exactly.
Yeah.
right? So
Yeah, I
something
want
like
to
that.
add
Being
something to that,
yes.
Paul. I'm sorry.
Mhm.
I want to just add. There's a lot of nurses who say, "Hey, Kay, I am out. I'm not in the United States yet. I am. I don't want to work in the hospital because the hospital pay is very cheap." Okay, I understand. Okay, so where do you go? I'm gonna go to BPO. BPO, business
Mm-hmm.
processing office
In the Philippines, right,
in the
right.
Philippines. Call centers. And then they
They
will
do get
say,
great insurance though.
yeah, the good insurance. But then you have to remember, if you have family and you're bringing over your family, and let's say your husband has I'm sorry, has health insurance. I mean, high health
Help.
maintenance
Mm-hmm.
or high health issues. You choosing a no experience employer. There's an employer who says we're accepting no experience. You're gonna work somewhere, nursing home, home care, whatever. We don't need experience. Come in here, you can bring your family. Don't expect the health insurance to be very good. If you think you're
Mhm.
saving, or if you think you're making more by working in a BPO setting in the Philippines, example in the Philippines, right? Coming here
Mhm.
in the United States will be the fastest. But I'm going to tell you, if you pick an employer who will not give you a very good health insurance coverage and you have a family member who needs those health insurance, I'm going to tell you right now, you might be paying 800 to 900 a month.
Right, right.
Okay, so if you're going to weigh in, am I going back to the hospital for experience, or should I just bring my family in the United States even if I don't have experience? It might be costing you more because you landed an employer who has no good health insurance coverage.
Mm-hmm.
And also
Right.
one more thing, when you have employers and they you will ask them, hey, do you provide health insurance? I'm gonna tell you right now, they will say yes because it's mandatory that most employers
That they
here in the
Mm-hmm.
have to.
United States they have to
Yeah,
offer you, yeah, right?
yeah.
So if
I
you
think
see
after a certain number of employee, after 50,
50,
after
yes,
number 50 employee, they have to, because that's Affordable Care Act rule.
yeah, and majority of the employers coming here, I mean hiring are more than 50 employees,
Right, right.
right?
Especially for
So
immigrant nurses, the recruiters outside the US,
yeah,
they
yeah.
Mm.
they do provide insurances, yeah.
Yep, and then they
But
will say, yeah, they will say, hey, the
there's a but.
insurance costs $900 a month, and you're earning $30 per hour. You're
Yeah.
not gonna make ends meet, not at all.
Mm-hmm.
You know,
900 is a lot of money, Kay,
yeah,
for
yes,
someone new in the US.
yes, because they will say, oh, we cover your family. But if you look at the numbers, yes, the employer will have to cover you, which is half the price, but your family is not half the price. Okay?
Right.
So which means if the total price of a health insurance cost is about, 600, you'll pay 300, but your family is going to pay 600. You will identify these employers when you see their monthly premium plan for family and single. It's really like duplicating when it comes with a
Yeah.
family. So you will
Right.
Mm-hmm.
identify them
Correct.
as that. So for me, I think that's a red flag if they are making you pay almost $1,000 a month of
Mm-hmm. Mm-hmm.
health insurance cost.
And
Yeah.
honestly, Kate, this is also where the bargaining power of big corporations come in. Because
Mm,
I
yeah.
was lucky because my first job in the US is with their healthcare group is UHS. You know they have healthcare groups here, the big companies, right? I'm under
Mm-hmm.
UHS, which is a Forbes 500 company. In short, they have more than 10,000 employees all across the US. And because of their bargaining power with 10,000 employees, our United Healthcare insurance, back then I'm not advertising United Healthcare. United Healthcare is one of those that are very, very strict with pre-authorizations coming from a primary care provider. United Healthcare, please get your act together. Anyway, um,
They don't want to
because
pay.
they don't want to pay. They're like, why are we doing CAT scan? Because it's my medical recommendation to do it. I'm
Yeah.
diagnosing something. It's needed, right? They like to ask questions a lot to the
Why
detriment of
do you
patients. Anyway, it's
And
hard
they
when
make
you're already a provider and you're getting all these emails back and saying, we did not approve the CAT scan, but the patient has cholecystitis or possible pancreatitis, whatever. That's why I just tell my patients go to the ER. Your insurance is not gonna say anything about that. Anyway, but
Mm-hmm.
to going back, but because my company was initially Forbes 500, I was paying cheap money for insurance because my company also has bargaining power. Cut it short, the smaller the company, the more expensive your cost will be because
Mm-hmm.
they don't have bargaining power, right?
Yep.
The bigger your company, especially if you are in academic research facilities, they are also paying for insurance of their residents. And they usually have the best insurance because they also provide internal services on top of their insurance. Like, let's say, for example, oh, if you work in this hospital, we are a research facility, tier one, Carnegie level, or we are level one trauma, and we have research facility here. We have residents and all sorts of nursing fellowships. Um, they might say this is your insurance coverage, but if you seek primary care with us or emergency care with us, you also get internal discounts. Because with me before with UHS, under South Texas Health System, we have insurance with United Healthcare, but when we get admitted to the hospital, we also get employee discount on top of it.
Yeah.
So that adds up pretty quickly to your savings. Use
Yeah.
that to your advantage. And again, it all boils down to what you receive entirely from an employer. It's not only your hourly pay. Okay, look at also your other benefits. Do I get free money from FSA or HSA? Do I get good insurance? If I don't get good insurance, is the money that I'm getting hourly worth it for me to get a healthcare marketplace compliant insurance? Because usually a healthcare marketplace is expensive. I was paying 550 out of pocket, but the money was worth it because I was earning good money from travel nursing, something like that. So always go back to your drawing board, go back to your budgeting. Some people like to write down on notebooks to compute their budget. I like Excel because it does the trick for me. Some people have their own thing, but guys, without the budget, you don't have a template of how you want to decide with financial stuff, such as what insurance is good for me. It's not only the cost that you pay for insurance, it's how much you're going to pay for medical care and how much risks you're willing to take. Are you okay paying that out of pocket maximum $10,000 if somebody goes to the ER from your family? Do you have that amount of money? Do you have access to that amount of money if that happens? Something like that, something to think about.
There's a question, guys. Zana, can we flash that question?
Mm-hmm. Is
See,
it okay? Is that the
yeah,
one that says, yep?
yeah. It says, is it okay to get private insurance because my employer charges more than the private insurance company? What are the pros and cons aside from the tax advantage with employers' healthcare HSA? All right. So you want to answer, Paul?
Yeah, I think the healthcare marketplace has a rule with that. Like, they say if the employer is providing you insurance, you may not qualify. So I'd say go to healthcare.gov. But then again, you can still, I think you can still get that, right? That's option B from your insurance, from your employer. There is a checklist where it says, I'm going to opt out of your insurance. So if you opt out, then that's your proof to the government, to the feds, that you can qualify for marketplace insurance. But be careful with private insurance. Some of
Yeah.
them say, oh, this is PPO. But trust me, guys, I worked in the ER and so many ERs in the US. Um, they would come in and they said, I have this insurance. And we don't even know the name. There's a database, in the hospitals to check for insurance because everything's electronic here. It does not come out. Apparently, it's catastrophic. Catastrophic is non-Affordable Care Act compliant. In short, your ER visit may not be covered. And what this insurance actually are offering is indemnity and catastrophic, which means pay out of pocket and then we'll reimburse you. Guys, I don't like that. Because if they say we'll reimburse you, it's like saying we're gonna think about it
Mm-hmm.
if we want to reimburse you. Or probably we'll reimburse you after a year, assuming that our company is still open. I don't think I like that, especially for healthcare. I think it's gonna stress me out. I think if I have appendicitis, the appendix would rupture before I even get to the ER, just because I don't know if the insurance will pay. You know what I mean? I don't want that risk, especially with healthcare. I don't play around with health.
So, to share my experience as a traveler nurse, we don't get our insurance as a family from company we use. We're traveler, we're not loyal to any company. We go to where the money goes.
you change every 13 weeks. That's why I
Yes,
just got my
like,
own insurance, because I don't want to be. It's so stressful to be changing
I don't want to
insurance
be,
every
yes,
13
and I don't want to
weeks,
be
8
timed up.
weeks. Right.
Exactly. So that's what Kate taught me. Anna, compute. How much are you
Yes.
saving versus how much are you getting? But
Exactly.
sometimes I complain about, oh my God, Kate, oh, the healthcare insurance. I got mine from New York Marketplace. It went
Right.
up to
Yours is expensive.
$50. Yes, we're paying 1,925
Oh my
every
God. Whew.
month for the three of us. For the three of us.
Oh my goodness.
But
That's a
one
house
time,
in Texas. I mean, Anna, that's a house in Texas with a big yard.
but wait.
Oh, what
One
yard?
time,
We're in New York. What yard are you talking
yes,
about?
what
You know that
yard?
yard is
We
a
love
billion
yards here in
dollar.
Texas.
We have the view. We don't have the yard, but we have the view.
I
So
know.
I was complaining, okay, and Clay said, okay, Anna, you're complaining. Let's get the calculator. So we got the calculator. He said, how much are you paying? How much are you getting paid, you and Ryan, every week? So we combine.
Mhm.
And how much is the insurance? It's like not even 20% of your income. What are you complaining about? I say, okay. Because at one
That's
point, I
crazy.
want to go back being a staff nurse because of the insurance. But when pay show me the numbers, show me the numbers,
Right. Right.
so I realize like like what you're guys saying, it really depends on your needs, and it's not a one size fits all. Like you have
Right.
a goal, you want to earn more, but you're complaining about paying more of the insurance, but the benefits of it outweigh. So okay, I'll stay a traveler and I'll get the
Right.
health insurance in New York. It
Right.
really varies wherever you are. It's
Mm.
different. New York has the highest price of healthcare
Right.
insurance.
And
That's why
and
it's
Anna,
named after New York.
correct. And to be honest, if you're self-employed, the insurance is tax deductible. So please
Yeah.
consult your tax preparer.
Yes, yes,
you're,
yes,
you're
yes.
paying a lot of
Yeah.
money for that.
Yeah.
But yes, if it makes sense to you, the 1,900 a month times in a year would be somewhere around 24,000.
Mm-hmm.
And if you get a stroke, you get a bill of $200,000 from your TPA, from being in the ICU, neuro ICU, from the all
Exactly.
the ER studies that they did, the multiple MRIs, you know what I mean, your rehabilitation and all that. I think the 24,000 still makes sense, but it can be overwhelming. I mean, I would be
Yeah.
scared with the 24,000 bill, to be honest with you guys.
Mm-hmm.
Um,
You can
but
always negotiate it. I
yeah,
always tell
exactly.
people, if you get a bill, it's like saying, "Hey, you owe me
Yeah.
one
Mm-hmm.
million."
Yeah,
Okay, so prove it, right? So prove it.
right,
But it doesn't
right,
mean that that you will have to pay that. I always tell people,
right,
please negotiate
Yeah.
your bill to come down. Always negotiate. If you there's a lot of social services in the hospital, and you can talk to
Mm-hmm.
them on ways. And these
right,
social workers are very happy to help you guys. Those are
right.
resources for patients for you to
And
use.
yes, and honestly, you can call the billing.
Yeah.
One time, Kay, my primary care provider sent my labs to another lab that's not CLP. It's not covered by my insurance, right? I almost had a heart attack because I always get labs because of my lipids, right? Lipid profile. So I got a $400 bill for CBC CMP lipid, which I could pay $20 with my insurance, right?
Mm-hmm.
And my PCP is like, oops, because they sent it to CLP. Whoever sent it, CLP, the other lab, billed me. But what I did, um, what happened was they sent it to another hospital instead of the hospital that my insurance is affiliated with, and that hospital sent it to another lab. Right? I called that hospital. I said, "Look, my insurance would only cover me. I mean, my copay for this is only $20, right? So you gave me a $360 bill. But you know, guys, what they did after I explained, they slashed off 90%. I only paid
Mm-hmm.
$36. I'm happy with that, right? And one time, of course, I went to the ER because I have irritable bowel syndrome plus reflux. It's not a good thing, you know, when you feel like you're having,
Combination.
yeah, ileus. Because I would get ileus now and then, right? Like my belly will stop digesting and the food will be stuck there for 10 hours. The only way to take it out is to
What?
suction. Yeah, I'd go to the ER, tell nurses, give me a suction, like an NG style suction, because that's what I need. It's hard, right? Anyway, to cut it short, I went to the ER, and then I got, of course, my ER copay is $500. I renegotiated that. They gave me $200 discount. I said, I'm a nurse. I work for COVID. I used to be an HCA employee. You know, I was trying to
You're
be cute on the
HCA
phone.
employee?
I used to be Meditech, but yeah, for
Did you get stocks as an employee?
I did, but I sold it. No, no, was it stocks? No, it's the 401k, right? They didn't give us stocks. I was PRN. But
Mm-hmm.
Oh,
man, HCA, ooh, HCA, you need to change your ways. Jesus is watching. Oh my God, I really don't want to work ER there, to be honest. I always tell my friends I love my coworkers there, but they treat you as a robot. Like everything has to be within certain time frame. We don't give reports to the floor. So if you are a medical telefloor nurse, I don't think HCA is. I don't know. I don't want to. I don't want to say
That's
something
another
bad and they
day,
can sue.
Papi,
But
okay?
anyway, cut it short. I was able to get a discount from negotiating. So don't be scared to negotiate, guys. It doesn't hurt to ask questions. It
Yeah.
doesn't hurt to
Mm-hmm.
call them. In fact, you might get discount. Well, if they didn't get
Yeah.
discount, then I mean, it's you know that you were gonna get the bill anyway. So something like that.
I was charged with $5,000 for
Mm,
ambulance, and the ambulance to the
woo,
hospital is like 5 minutes. I could have Uber myself, but I asked out, so I didn't know. When I woke up, where's
right,
I?
right,
And then for a month, what? I was like five
right,
thousand for ambulance, so I called. They gave me 50%, so it's like 2,500. And I was like, I'm not I've been out of work. Okay,
The
we're only
the
giving you
insurance didn't
1,500.
cover it. The
I'm sorry.
the insurance didn't cover it.
They covered a portion of it. So when they called and then
Oh,
this is another thing. Don't pay immediately. Wait for it.
right. Negotiate. Wait for the
So
bill. Wait for the
yeah,
bill,
Yeah,
and
let me
then until you
negotiate for
get
you
the
guys.
final notice. And then, I waited for the final notice to
me
negotiate the ER
too.
bill, right?
Me too.
And I just learned, I told them, this is not going to go to my credit report, right? They're like, no, we
Yeah,
can't do that for healthcare
Yeah.
related costs.
yeah,
So that's the first time I
right.
learned it back in 2021 that even if it's a final notice, they can put it in your credit report if it's healthcare related. So it's not gonna drain your credit report. So wait for them until they're frustrated, because you
Yeah,
know what? Put the
Yeah.
negotiating power back in your head. Let me tell you this: they'd rather lose $400 and get $100 from you versus not getting anything.
Anything
And
exactly.
yeah,
Uh-oh,
so
They
this
they
is
will
remember.
the dark secrets of American
Uh
patients. Uh-oh.
I heard
Uh-oh.
One doctor that I
What are we
co-worked with.
teaching
He works
here?
in the ER. He said he said you got an ER bill from our ER. So he called the ER, the billing department, after he got the bill, and said, can I get a discount because I'm an ER doctor here. But of course, ER doctors in Texas are not employees of the hospital. It's a Texas rule, right? So, but
mhm.
anyway, he works there. He got a discount, right? And then he renegotiated. After he got the discount, he got the new bill. He called his chief again and said,
Oh
"You know what? We have discount from the hospital, right? As employees, so they applied another discount. In short, he only
yeah.
paid 10 or 20% of the ER copay because he got two discounts over. But I mean, it's a loophole. It's not illegal. It's legal loopholes, but they're overpricing it. Trust me. Imagine they're billing
Exactly.
you when you get injections in the ER. They're charging you $700 for the nurse injection. I was like, I should be getting what's this? I should be getting commissions from this because I'm the one doing the shot or giving the shot.
Exactly.
Just for the shot. That doesn't include the meds and the supply. So it says there ER, what's this? I am shot. It's not even the Toradol that I gave. I am shot $700, Toradol $500. I was like, man, they really made a lot of money from the $30 vial of Toradol. Plus me, they pay me by the hour. So if I give like 10 IM shots that day, the hospital made $7,000.
Exactly.
That's the beauty and the ugly of having health
Yeah.
Health plan.
insurance on,
Yeah.
But
I
they
would say,
they
on
do
a
that for a purpose,
yeah,
Anna and Kay, because
yeah,
they know that insurance will renegotiate
yeah,
and people will
yeah,
renegotiate. So you renegotiate because they have so much buffer in there.
yeah,
Trust
Exactly.
me, even if you renegotiate and only pay 10% out of your total cost, do not worry, do not be sad. You're not the hospital is not gonna close tomorrow. They still have so much
No.
money, because it's for profit. That's their buffer. Their margin is probably 50 to 80% of the actual cost. So don't be scared to renegotiate.
And you're not gonna go to the jail if you're not gonna be able to pay, don't worry. I mean, I have a message one time that I won't have money, but my daughter needs to go to the ER, and they told me I have to
yeah,
pay this X amount. I said, no, go to the ER right now. Don't worry about the
Yes,
money. They're gonna take care of
yes.
your
And
daughter.
you can put it to payment plans, zero interest for
yeah,
healthcare costs.
Exactly. Mm-hmm.
yeah,
ER is not the time where you need to think about what's my deductible and out of pocket maximum.
yeah,
Like I said, no amount of money is worth it a human's life, whether it
yeah,
is your kid, whether it is yourself, your spouse, your parent, your friend. Guys, please do not hesitate. That's what the ER is for. As an ER
Mm-hmm.
yeah,
nurse, as a former ER nurse, that's what we love to see in the ER. We're here to help in emergencies, but we're not here for strep throats and UTIs. That's our
Exactly.
primary.
yeah.
Yeah, but
Don't do
don't
that. Yeah,
hesitate with that. We're there for you guys. So don't worry about, oh my god, my out of pocket maximum, because Dr. Nurse Paul said to
yeah,
check the out of pocket maximum. It says 10,000. I don't want to go to the ER. But guys,
yeah,
you still have a long life ahead of you, and you
yeah.
can still make that $10,000 over and over. So
Yeah.
don't waste that time to think about emergency care.
Okay. I want to share a last screen because a lot of people have asked me, Kate, the employer in health insurance options are quite expensive. Where else can I look for? So I want to
Mm-hmm.
share a quick screen on how are you going to go around it. So can you guys see my screen now?
Yeah.
Okay, so on the left side, you will see all the companies. This is not all, but
Mm-hmm.
the major players of the health insurance here in the United States. Okay,
Mm-hmm.
so the first place that you will really have to check on where to buy health insurance is first is your employer. Always go with the health insurance plans provided by your employer because these are, like Paul said, and these are negotiated and this can be cheaper when you go to your employer. But there are also bad employers. I'm going to emphasize this. Bad
Highlight.
employers bad employers who I've noticed, how I've observed this, bad employers will intentionally pick the most horrible health insurance plan.
Mm-hmm.
And why do they do that? So you will not get it from them. Okay?
Yeah.
This is what's happening in reality right now with a lot of
Mm-hmm.
foreign nurses, that
Mm-hmm.
there are employers who intentionally pick the most horrible, the least cover, and the most expensive health insurance plan. So these nurses or employees will not go to them, but just because they're mandated by their employers, I mean by the government to provide health insurance, so they will provide, but there's no guideline on what they will give, right? So now these nurses were even told to go check Medicare, right?
Mm-hmm.
Or Medicaid. I'm like, if your employer is telling you to go to Medicaid or Medicare, please,
Uh,
please use that as a red flag. Your employer has no intention to take care of you by giving you a very good health coverage.
hold on,
Okay.
okay. I think Medicare is for above
Older.
65.
Yeah,
Yes.
Medicare. Yeah, because I mentioned that because we have a lot of nurses who come here with their dependents as well.
Oh
You
yeah.
know, yeah, we have nurses who come here after 50 and their spouses are actually on the older side. So
Mm-hmm.
I got a message that we were told that to send my kids to get CHIP. CHIP is Children's Health Insurance Plan by the government. So
Mm-hmm.
these nurses were told to use or consume the government provided health insurances. But please, before you do anything, check your employer first. And then if
Mm-hmm.
you feel like your employer is giving you a horrible insurance, the next
Yeah.
option is go to online. Okay. So healthcare.gov is a website by the
Healthcare.com.
government to give you the different health insurance plans. Okay.
Mm-hmm.
If you still don't understand what you're buying, sometimes it's good to use a broker. However, what a broker does is they will say, hey, I have access to all this health insurance plan and I can give you the best one. Okay. Some the good brokers will give you all the best, the best what is best for you. However, there will be also broker who will say, I have access to all the health insurance plan, but at the end of the day, even though you found a better health insurance plan with a different company, he will offer a specific health insurance plan. And why is it? Because the commission is higher there. Okay. So again, if you go with broker, there's pros and cons. Okay. Pros and cons is he will offer you all. But the cons of that is sometimes they will push you to buy the one that has the most commission for them. I'm not saying all broker are bad, but I'm saying I have come across, I would say 6 out of 10 brokers that I have talked and guided me to buy the most expensive. I mean the insurance plan that's not best for me, but the best for his pocket. Okay, so
Yeah.
there are good and bad, and I always say that do your research, write down when you're trying to buy your health insurance, write down how much is the employer is what are the employer options, number two, what are the online options, and number three, what are the broker options. So
Right.
please, you have to see what's best for you guys, and
Mm.
and just choose, what's best
Right.
for you, not what's best for the pocket of the brokers.
And then, Kay, I like for our viewers to understand that here in the US, the culture is the power is to the consumers. So don't be scared to ask questions, have brokers run it, but politely tell them, I'm sorry, I found a better one. but you can ask two, three, four brokers and do a head-to-head comparison yourself. Do not be scared to do that. A lot of these brokers would offer that for free. They just don't want you to waste their time as well. So if it's time to like say, you know what, I do not want to do that, or I do not want to avail this because I found a better one, maybe they can match it, or maybe they can't. They just move
Yeah.
on, you move on, and that's good. But don't be scared to ask questions. A lot of, especially for Filipinos, we have this mentality where, oh, ano ba sa Tagalog? In Filipino, it's nakakahiya, right?
Nahihiya
It's
ako.
yeah, nahiya ako. Like, how do you say that in English? Like, I feel it's not embarrassed because how do
You
you say
felt
that?
bad
Like,
to say no?
I feel bad to say no. Yes, like I feel bad saying no to this person because he already
Mm-hmm.
started working for me. But that's the power of consumer, and there is what's this? The advantage of competition, and that's what we're promoting here in the U.S. Competition gives power to the consumer. So do not be scared to ask questions. At the very least, talk to two or three different brokers, compare three, four, five different insurances, and decide based on what you need. But don't settle for
Yeah.
something just because they're your friends or you took their time to run insurances. It
Mm-hmm.
doesn't take them a long time to run insurances. Everything now is by database and electronic. It probably takes them
And
10 minutes to run those numbers and comparison charts that you probably
yeah.
could do yourself in
Yeah.
healthcare.gov or something like that.
Yeah.
But the power is yours. Do not be scared to ask questions. Do not be scared to say no as well. Okay?
Yay. Yep, I think that's great information that I hope all our listeners are new nurses, not only are foreign nurses, but new nurses who are jumping
Everyone.
in to
Yeah.
new
Mm-hmm.
professional life. Yeah, everyone who's jumping into their professional life and starting their adulting 101. Adulting is not easy. We still try to stay in our comfort zone by being fed everything. But when you become adult, you really have to be conscientious of the things that you are purchasing for yourself, and as well as protecting yourself through health insurances.
All
Yeah.
right. And I think that's our final show for the year. And we're going to take
Yeah.
a Christmas break, holiday break. Happy holidays to everybody.
Oh my
And
Yes,
God. Few
Christmas.
more days.
Yeah,
yeah,
2024. Here we go.
your
8 more
wonderful
days, right?
hosts, Nurse Anna and Travel Nurse Hacker, and myself will take holiday break to spend with our families. But we will be back in January. We will be announcing our shows through our social media very
Mm-hmm.
soon. If you guys want us to discuss something in our shows, please send us an email. My email is info@drnursepaul.com, but you can also send a direct message to Anna Travel Nurse Hacker
Mm-hmm.
to tell us what you want us to talk about because we're still lining up topics for January. But we will see you guys. January, it's going to be every Sunday, still 8 a.m. Central Time, 9 a.m. Eastern, 7 a.m. No, 6 a.m. Pacific Time, and you do the math for your own conversion to whatever country you're in because there's a lot. But thank you guys and happy holidays, Anna and Kay. I'm
Thank
accepting
you,
gifts.
everyone.
You too, Paul. Happy holidays, everyone. Happy holidays. And
Happy holidays.
stay safe and stay healthy. The cold is
Mm-hmm.
coming. Winter is coming.
I
We're here.
know.
We're freezing.
Hmm.
Stay warm.
Yeah.
Stay
Don't
warm,
forget,
everybody.
congratulations or go for Karen.
Congratulations to
Congratulations.
everybody got current with the latest
Yeah.
visa bulletin. Woohoo!
Disability.
What a happy new year for a lot of you guys.
Yay.
Okay. Thanks, everyone. Have a good day. God bless us all.
Bye.
Bye, friends.
Bye.